Actually, this is the first time I have come to the oath taking of nurses. This reminded me of my own Hippocratic oath taking when I graduated from Bangalore Medical College. Actually, Ganesh Chaturthi is next week, but this place is already charged with so much emotions and happiness that I'm already feeling like it is a festival today. First of all, I would like to congratulate all the nurses who took the oath and all your parents who have sent you all the way. So I would like a small interaction with you all. So all the newcomers, tell me how many of you are not from Karnataka? You may raise your hands. How many of you are not from Karnataka? Okay, I think significant, maybe 50% are not from Karnataka. I welcome all of you to Shimoga and to Nandappa Academy in pursuit of your nursing courses. Did you know that India is the largest producer of doctors, nurses, lab technicians and other healthcare professionals, and it is a supplier to the whole world. But ironically, in India, we are facing shortage of healthcare professionals ourselves. So, in the COVID times, you might have read in newspapers when second wave of COVID hit us. There was the biggest problem was not shortage of ICU beds or oxygen. Somehow we managed the oxygen production with the help of industries, but the real problem was shortage of healthcare professionals. There was shortage of doctors, shortage of nurses, and many nurses were scared to work in, no, even doctors, they were scared to work in COVID ICUs. And tell me, we can put beds in the ICU. Isn't it very easy? We'll put more beds in the ICU. What is the problem? What is an ICU bed without a doctor and without a nurse? So what gives meaning to an ICU bed is the nursing professionals, the doctors who could take care of the patients. So I hope with all of you graduating and we will soon address this problem of shortage of healthcare professionals in India. So you lit the lamp and you have taken the oath, and your oath is similar to the Hippocratic oath that doctors take. And what I feel is that there is not much difference between a doctor and a nurse. We are all part of the healthcare team, and we all play the same role in the lives of a patient. So I hear some of the nurses telling that see, we do all the groundwork and it's always the doctor who takes credit. Patient always mentions that this doctor treated me. But let me warn you that it is wrong. So we take these reviews from our patients, the patients who come to our cancer department. When they finish their treatment, we ask them, how did you feel about our department? So if you read reviews of our department, they would have mentioned that Dr. Aparna Srivatsa treated us very well. And these are the particular nurses who took care of us. They gave very good care to us. So you will definitely get mentioned. Yes. So I'm really happy that I have a team of dedicated nurses with me who give name to me. What I feel is it's because of them that I'm getting credit. So, and it is seen in in our life that if you are caring, if you are hardworking, if you are dedicated, if you have the skill sets, definitely patient will definitely remember you. They will definitely mention your names. So I want all of your names to be mentioned by the patients. I hope you all make a difference to the patient. So when you lit the lamp, it was said that lamp is an indicator that you are spreading knowledge. Lamp says that ignorance will be overtaken by knowledge. Not only that, when it comes to healthcare profession, lamp also tells you that you will have to work day and night. You will not only work in the day, but you will also work in the night. So that is how when we talk about Florence Nightingale, we call her the lady with the lamp. So she was a person who It was 200 years back when she started this nursing profession, and she made an impact. And people, more than the doctors, they recognized her as the lady with the lamp because she took extra care. She used to go in the evening, do rounds, and see how the patient is doing. So I remember many of my teachers in Kidwai teaching us, see, you may be MBBS, you may be MD, or you may be a super specialist, but you should always be a human first. So what differentiates a human being from a wild animal is that we have emotions. If a patient is crying in pain, if the families are crying in pain, if we cannot understand their suffering, we are not humans at all. When we talk about manpower shortage and healthcare professional shortage in India, everywhere it is a shortage of manpower. But when it comes to nursing, it is the shortage of woman power. So we saw that most of the students are young girls and very few boys were there. I welcome all of you, male or female. I don't discriminate, but we have to accept that the nursing profession is dominated by women. So why is it so? I think naturally women have more care. Women are more caring. It is in their genes, because a woman has to take care of the child. If she doesn't take care, the child will die, isn't it? So it is in our genes that we are caring, we nurture, we take care of others. So that is how nursing has become dominated by women. It's a very good thing. So many of my relatives, they ask me, which is the best profession for my girl? What profession should she take? I tell that every profession is fit for women. Women can do everything, any profession they can join, that's okay. Let them be politicians, let them be doctors, let them be engineers. And we have seen just a few days back that 3 of the Chief Justice were women. They took their oath as Chief Justice of Supreme Court. So women can do everything, but in many studies it is seen that women feel insufficient. Though they are equally qualified, they feel genetically, they feel always that self-doubt. They have that doubt in mind. Did I do it correctly? Did I not do it properly? They are always having this doubt in their mind whether they did it correct or not. So I want you to overcome that self-doubt and grow more and more confident. It is seen that equally qualified men and women, if you see in their job interviews, the men appear more confident. They come up with, they boost about their own qualifications and experiences. I want you to come up with small exercises every day and feel more and more confident about yourself, and you conquer your self-doubt. And as you grow up in life, there are a lot of situations where when you are doing your course, when you complete and go out for a job interview, or when you start practicing, you'll come up with lot of difficulties in your life. But I want you to be confident, and you conquer your fears. And skills are very important. So I'm very happy that you have come to the right place at the right time. You have very good teachers here in Nanjappa Academy, and also that the clinical practice is also very good. You get to see lot of patients, and you get to see the state of art treatment facilities that are being done. Though you might have your own thoughts about Shimoga. Usually people, when they hear about Shimoga, they think it's a small town, but it is no longer a small town, and it is the healthcare industry in Shimoga. It is growing by leaps and bounds every day, and I'm sure you will enjoy your course in Nanjappa Hospital. So I have lot of hopes for you. I hope that you all learn a lot in your course. In the 3 years, you will learn a lot. You will improve your skill set. You have wonderful teachers. I compel you to learn everything that is possible in this course, and once you have your degree, I think sky is the limit. You will get a lot of opportunities in your life, and you will make a very good career after passing out from Nanjappa Academy. So I wish you all a very good career, and all the best for all your future endeavors. Thank you.
Thank you, madam, for such an inspirational speech.